You're watching HuffPost Live. I'm Caitlin Becker. Sometimes you're just not up for getting it on. Whether you're tired, sick, or just not feeling sexy, it happens. But if you've got a consistent case of the sexual blues, it could be something more serious. So our experts break down the top reasons why you might not be in the mood. And they can offer suggestions to help you get back in the game. Joining us in our Google Hangout, we have Dr. Laurie Mintz, the author of A Tired Woman's Guide to Passionate Sex. She's also a professor at the University of Florida. And Dr. Peter Klatsky, a board-certified obstetrician and gynecologist. He's also an infertility specialist at Montefiore Medical Center. Thank you both for being here.
Thank you.
So a recent post on the Huffington Post listed the 10 reasons why you don't want to have sex tonight. And number one is something we hear all the time: insomnia. I'm sure we've all said, I'm tired at some point. But Dr. Mintz, why is sleep so important?
Well, sleep is so important because if you are exhausted and you get into bed at night, the last thing you're going to want to do is to have sex. You're just going to want to fall asleep. And that's what I hear over and over and over from clients is it's all, as soon as I get into bed, I just want to go to sleep. I don't want to have sex. And the interesting thing is, though, having sex actually is a great sleep aid.
So should we, if we're too tired to have sex at night, should we be changing the time of day that we're having sex?
That's a great question, yes, and that's something I recommend to clients. And in fact, there's reason to believe that women's sex drive is lowest at night because of some hormones. And so having what I call in my book trysts, having scheduled other times that aren't at night to have sex, is something that really works for a lot of exhausted, low sex drive women.
They call it afternoon delight for a reason, apparently. Number two on this list is a more serious one. You've grappled with infertility. Dr. Klatsky, how much does this affect your sex drive? And is it just biological, or is it also emotional?
Oh, I think it's definitely both. I think, but I think more so emotional. There's tons of studies that have shown that patients experiencing infertility, and particularly going through treatment, experience tremendous emotional and psychological stress, comparable to having cancer and even other severe illnesses. So a lot of times it's really difficult. And then sex becomes a chore. It's something that I prescribe sometimes. I have to tell couples when to have intercourse, when to have intimacy. So it takes a lot of the spontaneity out of it. And unfortunately, that coupled with the stress can be really damaging to your personal life.
When it comes to an issue like infertility, does this specifically affect a woman's sex drive, or does this affect the couple as a whole?
I think couples are a unit. I think they're a team. So I don't think it can just affect one person's. And if it does affect one person's, it's almost always going to, extend over to their partners. So yeah, I think it affects both of them.
We have a comment that I would like to pull up. One second, it's not pulling up fast enough. Mary Batout says, I have been under high stress this past week, and my anxiety tends to kill my libido, which is ironic because sex is a stress alleviator. I told my BF no last night because I thought he would want me to be honest about how I felt. He was disappointed, and it made me feel worse. Stressors, outside of the bedroom do seem to creep their way in, and either one of you can jump in here. How are we supposed to handle that? In this case, she was honest, and it kind of blew up in her face.
Well, I really applaud her for being honest. And a good sex life, a good partnership requires honesty both about sex and in general. And I think that her and her partner would really benefit from what I call kitchen table sex talks, which is when you sit down and talk about your sex life at a time when you're not planning to have sex, you haven't just had sex, you're not about to have sex, and really talk about what happened between the two of them and how they can prevent that kind of issue in the future.
So interesting that you brought up kitchen table sex conversation, because there's no time that is more unfortunate to get rejected than when you're actually trying to have sex. So doing it on neutral ground is a very good tip. But moving on this list, number 3 is someone cheated. This is a hard one. And Dr. Mintz, how do we get over this as a couple if you're going to try to get over it?
Well, that is something that I really recommend counseling for, couple counseling with a qualified therapist, because an affair really wreaks havoc on the trust. And the trust that was broken is the trust in the bedroom, really. My partner did, or I did this with someone else. And, of course, then it's going to have repercussions in the bedroom. And there's lots of great self-help books. There's one called After the Affair, which couples could try on their own, but I really recommend counseling for dealing with the trauma and pain of infertility.
So moving on to one of the more biological ones, you're a new mom. And Dr. Klatsky, here we are again. Is it biological or is it emotional? Let's talk about biological first. What actually happens to a woman's libido after she gives birth?
Well, I think there's two biological critical things. One, as you mentioned, insomnia. Being woken up every 2 to 3 hours is definitely going to lower your libido. Women do have different hormonal profiles. They have higher prolactin levels, especially if they're breastfeeding. If you're breastfeeding, your estrogen level is going to be lower. Your testosterone level may be lower. We know that neurons in the brain do have receptors for these hormones. So having an altered hormonal environment absolutely affects your libido.
And it changes your body physically.
Oh, absolutely.
Absolutely. I mean, specifically with the woman's anatomy, how soon after she has a baby can she even have sex, and how soon is she even going to want to?
It's a great question. Those are two different questions, right? So desire involves intimacy, it involves your partner. But I think anatomically, depending on the mode of delivery, we might recommend a month to 6 weeks of pelvic rest. That means no sex. One thing that can also happen, particularly if a woman delivers vaginally and has a tear that's repaired, and then follows that with breastfeeding, the low estrogen level can make it take time for the vaginal repair, the laceration, to repair. If a woman's upfront with her gynecologist, and if the gynecologist is sensitive to that and is asking questions, they can often prescribe some topical estrogen cream that can also make it so that the vaginal mucosa, the lining of the vagina, heals quicker. Nobody really wants to have sex if they have a tear or injury in there.
Yeah, you think? That sounds horribly
Sounds
painful.
terrible.
You know, on top of that, Dr. Mintz, I'd love to get your take on how women feel about their bodies, especially after they've had a baby. I mean, this comes up all the time when you just don't feel sexy. So how do you rectify that?
Body image and women's sexuality is such a complicated issue because so many times women feel badly about their bodies. And I hear so many women say, whether it's post-birth or later, that they're trying to hide under the covers or they're holding their stomachs in. And obviously that leads to really sexual dissatisfaction because you can't be aroused and self-conscious at the same time. And what I recommend for that is something that's been shown to be very effective in sexual functioning in general, which is mindfulness, which is that notion of really being immersed completely and fully in the sensations of the moment. And you can practice that in daily life when you're taking a walk, smell the flowers, feel your feet on the ground, and really practice a present focus in everything you do, and then try to bring that into the bedroom and focus really on the sensations of your body, what you're feeling, and get out of your head in terms of what you're looking like. And the other thing is to talk to your partner. So many times women will say, oh, I look terrible, I feel terrible, and their partners will say, you look beautiful to me, and to really listen to that and take that in.
So the next one on the list is that your thyroid is off. And Dr. Klatsky, I don't think I've heard this one before. Can you explain it to us?
Sure. The thyroid affects, or thyroid hormone affects, nearly every cell in your body. It's one of the more important hormones, starting when we're in our mother's uterus, and it continues thereafter. About 4% of women in the U.S. have what's called subclinical hypothyroidism, so that their thyroid's not functioning optimally and they don't even notice it. And there may be subtle signs like decreased libido, decreased energy level, constipation. So if women are experiencing these things, it's worth sharing with their provider, going and getting an evaluation.
So moving on to the list, number 6 is you're taking medication. Dr. Mintz, how do we know if it's us or it's the medication that we're taking?
Well, I would say speak to your physician and ask if sexual low desire or vaginal dryness, or if there's any sexual side effects of the medication, first and foremost. And a lot of times things are, start as one thing, a reaction to a medicine, and then we get freaked out about it, and it becomes more psychological, anxiety-based. But first of all, talk to your physician and find out if there's a sexual side effect of the medicine that you're on.
And Dr. Klotze, what do you recommend for women who find out if it's their medication? And also, does that work for men as well? Can men be affected by medication the same way women can?
Both men and women can be affected, yes. And I think I think what Laurie points out is that that one thing could start as one thing. Somebody could be depressed. Maybe they're started on an antidepressant. Many of the common antidepressants cause hypoactive sexual desire. So going over that with your physician, we can change the antidepressant if that's the drug causing it. Other common medications are oral contraceptive pills, and there's other forms of birth control that can affect it as well.
So number 7, we touched on briefly when we were talking about women and their post-baby bodies. You're insecure about your bodies. Dr. Mintz, it's so funny when we talk about these things like insecurities about our body or not being in the mood for sex, we always assume that it's a female issue. But do men also have these insecurities as well? And how do you help them?
Absolutely. Men have these insecurities as well. And the way to help men, is the same way to help women. Having them focus on mindfulness, the sensations of the moment, the love, the connection, to talk to their partner. And also, I would be remiss if I didn't say that sometimes in a long-term partnership, the elephant in the living room, if you will, is that the couple actually, one of them has lost attraction for the other. And then that's an issue that has to be dealt with, probably with a therapist is the best way, but it has to be dealt with directly as well. So sometimes it's a woman feeling or a man feeling really bad about themselves, and sometimes it's an issue with lost attraction in a relationship.
Number 8 on the list is that you've gone through a big hormone change. Dr. Klotze, explain to us how this works.
So the biggest change in a woman's life comes at the menopausal transition. So that's when the ovaries stop producing estrogen. But the other transition that occurs around a similar time, sometimes as women age past their 50s, 60s, and really starts at age 30, is a decrease in androgens or male hormones produced by the adrenal gland. Nobody really talks about this, but there's an overwhelmingly large amount of data supporting the fact that low testosterone or low male hormones, which all women have, are associated with decreased desire. And there's actually a bunch of studies in women who are postmenopausal that if you give them a low dose of transdermal testosterone, you can actually restore this desire. But when you're taking care of patients with that complaint, the first thing you want to do, which Dr. Mintz pointed out, is see if there's other things going on. So, for example, if a woman is complaining of vaginal dryness and abrasions, that can occur with low estrogen that is also associated with menopause. So first you restore that, make sure that there's not pain during intercourse. But if a woman traditionally has had a very satisfying and fulfilling sexual life and notices in her 50s, 60s, 70s even that she's not having the desire that she's loved and not enjoying that intimacy with her partner, then I think trying some transdermal testosterone can be really satisfying.
Number 9 on the list, stagnation. Objects in motion stay in motion, and objects at rest tend to just lay there. Dr. Mintz, how do we help these people?
Right. What you're talking about is making sure that the low desire isn't due to boredom. And the solution to boredom is to spice things up. People are motivated to try new things. Kids like new toys more than their old toys. And so there are many, many things that couples can try, and it's always best to start with the kitchen table sex talk. Does this sound good to you? Does this, what about this? And for people never to do things that sound aversive, but to stretch their boundaries. New sex toys, new lubricants, watching an erotic movie together. There's sexy board games that couples can play together. So really trying to spice things up a little bit, try new things.
Dr. Mintz, this dovetails so nicely with our final point on the list, your partner's technique. How in the name of the good Lord do we tell the person that we're sleeping with that you don't like their technique?
And that is a problem because a lot of times women or men, they won't like their partner's technique, and they fake that they do, and then the partner keeps doing it, and the same thing. So really, again, we're back to kitchen table sex talk, but they have to start with the words I and be couched in a lot of loving terms. I really love you. I really care about you. I really want us to have a good sex life. So I need to talk to you about this. I'd like us to do some things differently. I'd like you to touch me differently. I'd like to show you where to touch me the next time we have sex, and that kind of thing.
It's an excellent piece of advice to end on, but we do have to end it here. Dr. Mintz and Dr. Klotze, thank you so much for joining us. This amazing list of reasons why you're not in the mood is in our resource well below, and all of these tips will be available to you. Stay tuned here at HuffPost Live for more great conversations.